I guess we can just start off with introductions. So for the class, if you don't know me, my name is Allison Dewey. I'm obviously a student at Pierce College. And if you would like to introduce yourself and just state what your profession is and experience in the medical field, you can go ahead.
Hello, I'm Kathleen Nelson. I'm a emergency medicine physician assistant, and I've been a PA for 25 years and been in the emergency room for 10 years.
My first question is, have you personally noticed an increase in patients suffering from opioid addiction? Like, do you have any personal testimonies or seen an increase in the past 10 or so years or anything like that?
So I think there's been a big increase in the time that I've been in the medical field. And during the last 10 years in the emergency room, I see it on a daily basis. I might not see an overdose death on a daily basis, but I see people with addiction issues, and it may or may not be the reason that they are coming to the emergency room. Sometimes it coexists with other illnesses,
Right.
But almost every day I take care of somebody with an opioid addiction, probably multiple people every day. Yes, there are a lot of different choices for pain management. Ibuprofen and Tylenol are actually pretty good medications. People sometimes are a little hesitant to give them a try, but they work pretty well. And then we have other non-narcotic pain options. But what I have noticed is that for people who are, they might have a fracture or a surgery where the non-narcotic things just might not provide much relief. I have noticed that the providers, meaning the doctors and physician assistants and nurse practitioners, are prescribing a lot less opioids. They may prescribe, maybe they used to prescribe enough to last the patient for 2 weeks, and now they're only prescribing them enough for 3 days, which should get them through the worst of the pain. So I have seen that improvement, along with what you're saying with the non-narcotic medications.
And I was curious if lowering the dosage or the daily usage, does that reduce the likely chance of addiction? Or is it kind of like one person can take one pill and become addicted, when the next person, it could take a couple weeks or months of taking the same opioid?
I think that's both. I think if someone has a legitimate painful injury where they're on the medication, a high dose for a long time, they're going to be more likely to be addicted. But then also, I feel like it's very individual. Like for me or for you, it's hard to say if I'm on that pain medication, am I going to be one of the people that then craves it or not? And I don't think we really know until we try. And so that's the scary part. The only thing I would add is that I think a lot of throughout the county, we are really trying hard to reduce the number of prescriptions written and to offer help to people. There's a lot of help available. We have a substance use navigator on staff in the emergency room that will help any of the patients that want help. So if people need help, it is available, and they have to want to get help though.